Moving beyond the terms anatomy and physiology, and we have a whole range of terms used to describe body direction, regions, and planes. These terms are precisely defined and allow us to communicate clearly and without confusion. So beginning with planes, and a plane is a two-dimensional slice through a three-dimensional space or object. When we study parts of the body, we study them or describe them relative to these planes. The three major planes that are used to describe body anatomy are the sagittal, frontal, and the transverse plane. The sagittal plane is this one here, which divides the body into a left and a right section. The frontal plane, which is also termed the coronal plane, runs along the midline here and divides the body into a front and a back, or an anterior and a posterior section. And then the transverse plane, which you can see here, divides the body into an upper and a lower, or a superior and an inferior section. So taking a closer look at each of those planes, and here we have an image of a skull in the sagittal plane. So remember, a sagittal plane divides an object into a left and a right section. These sections may not always be equal, but they will always divide the object into a left and a right part. It's common that we use a sagittal plane to look at the skull, as it allows us to see these external bony structures as well as what's inside. Here we have an image of a heart in the coronal plane. So it's dividing the heart into a front or anterior and back or posterior section. This view allows us to see inside the heart and see those four chambers nice and clearly. And then lastly, we have an image of the trunk. This trunk is in the transverse plane. So dividing the trunk into an upper or superior and a lower or an inferior section. Now, for context, this section would be roughly at the height of the belly button. This would be the front of the trunk here. This is the back. We can see our spinal column, our two kidneys, liver, part of the lungs, our intestines, and the pancreas. Now, building on the planes that we use to section the human body, we also have a range of terms that we use to describe the position of one part of the body relative to another. These directional or anatomical terms are grouped in pairs that have opposite meanings. Now, if nothing else is taken from this module, this table here is the one thing that I want you to learn. These terms we will use over and over again throughout the rest of the semester. So looking at each of these terms one by one, and the first term that we have is anterior, and anterior pertains to the front of the body. So using anterior in a sentence, you might say that your belly button is on the anterior surface of your trunk. Posterior is the opposite to anterior and pertains to the back of the body. So again, using posterior in a sentence, you might say that your heart is posterior to or behind your sternum. Superior means higher than another point of reference. So for example, your head is superior to your feet. Inferior means lower than another point of reference. So you might say that your feet are inferior to your head. Proximal means relatively near a point of origin or attachment. So your elbow is more proximal than your hand in that it's closer to your shoulder, which is where your arm attaches to your body. We also use the term proximal in relation to the anatomy of some of our organs. For example, we have the proximal convoluted tubules in the kidneys, which are the tubules that first extend out of the Bowman's capsule. And then the opposite of proximal is distal. So distal refers to be relatively distant or far from a point of origin or attachment. So you would say that your hand is more distal to your shoulder than your elbow. Medial means towards the midline or the middle of your body. For example, your nose sits medially on your face. Lateral is away from the middle of the body or to the side. So your ears sit laterally to your nose. Superficial is when something sits relatively closer to the surface of the body. So, for example, your ribs are superficial to your heart and your lungs. And then deep is the opposite to superficial, so relatively far from the body surface. So you would say your heart and your lungs are deep to your ribs. They sit further inside your body. Prone is describing a reclining body where you are face down. So think of a prone or a plank hold. The body is reclined or stretched out and it is face down. And lastly, supine, which is the opposite. So a reclining body that is face up. Think about lying on your back, looking up at the sky. Now, I mentioned at the start that this directional or anatomical terminology is used to describe the position of one part of the body relative to another. However, how accurate this terminology is depends on the position that your body is in. For example, it's correct to say that the wrist is above or superior to your fingers, but this is only true when your hands are hanging down by your sides. If you put your hands up above your head, your fingers are superior to your wrist. So to prevent any confusion of this kind, when we are referring to the position of a body part, we describe that body part assuming it is in, or it has started from, this anatomical reference position. So in this anatomical reference position, which you can see here, the subject stands erect, facing the observer. Their head is level and eyes are facing directly forward. The lower limbs are parallel and the feet are flat on the floor, facing forward. The upper limbs are at the sides and the palms are facing the front. Now, in anatomy and physiology, if we were describing the position of a body part, this is the position that we assume the subject to be in. Now, on top of planes and anatomical or directional terminology, we also have body regions that can be identified externally, and then body cavities, which are internal spaces that typically enclose organs. So examples of body regions include the head, the neck, the trunk, the upper limbs and the lower limbs. Examples of cavities include the cranial cavity, which contains the brain, and the thoracic cavity, which is formed by the ribs, the chest muscles, the sternum, and the thoracic part of our vertebral column. Within a cavity, you can also have another cavity. For example, the abdominopelvic cavity can be subdivided into our abdominal and our pelvic cavities, which contain the stomach, the liver, and the intestines, and then the urinary bladder and our reproductive organs, respectively.